Herpes zoster infection is an acute, painful, blistering viral infection of the skin and can occur in childhood, but is much more common in adults, especially the elderly, sick, or immunocompromised or immunosuppressed. The primary infection presents as chickenpox, that's varicella, usually during childhood. Like herpes simplex, the virus persists usually in the anterior horn cells before it is reactivated. Post herpetic neuralgia is a common complication and defined as persistence or recurrence of pain more than 1 month after the onset of shingles. So the cause is varicella zoster virus, and the symptoms are fever, severe pain over areas involved, headache, blisters. The main signs that are usually listed are fever, tender vesicles, usually spread within one or more dermatomes unilaterally, and regional lymphadenopathy. Investigations, usually none, but HIV screening could be done as in recurrence or multi dermatomal cases. Main treatment objectives are to provide adequate pain relief, to prevent secondary bacterial infection, to limit extent of disease spread in immunocompromised patients, and also to prevent complications. Non-pharmacological treatment is mainly bed rest. Pharmacological treatment for mild herpes zoster infection, you give use a cyclovir cream 5% topical in adults 4 hourly 5 times daily for 4 to 5 days. In children 4 hourly 5 times daily for 4 to 5 days. It starts immediately the premonitory symptoms are felt or within 48 hours of the onset of the condition. And also you give diclofenac oral in adults 50 milligrams 8 hourly for 7 days, or you can give ibuprofen oral in children 5 to 10 milligrams per kilogram 6 hourly for 7 days. Then you could also give povidone iodine 10% topical. In adults, apply to blisters daily till lesions resolve. In children, apply to blisters daily till lesions resolve too. For severe herpes zoster infection, they give a cyclovir oral in adults 800 milligrams 4 hourly 5 times daily for 5 to 7 days, and in children more than 12 years, give 800 milligrams 4 hourly 5 times daily for 5 to 7 days. Then they give 800 milligrams 6 hourly for 5 to 7 days for children 6 to 12 years, and 2 to 6 years we give 400 milligrams 6 hourly for 5 to 7 days, and less than 2 years you give 200 milligrams 6 hourly for 5 to 7 days. And then you give diclofenac oral in adults 50 milligrams 8 hourly for 7 days, or ibuprofen oral children 5 to 10 milligrams per kilogram 6 to 8 hourly for 7 days. And then povidone iodine 10% topical in adults, you apply to blisters daily till lesions resolve. In children, apply also to blisters daily till lesions resolve. Post herpetic neuralgia, you give amitriptyline oral in adults 25 to 50 milligrams daily to resolution. children is not indicated for this condition. You can give carbamazepine oral in adults 50 to 150 milligrams 12 hourly to resolution. There's a maximum of 600 milligrams 12 hourly. In children 12 to 18 years, you give 50 to 100 milligrams 12 hourly, and then you increase to 60 milligrams 12 hourly if necessary. 1 month to 12 years, give 2.5 milligrams per kilogram 12 hourly, and then you increase slowly to 5 milligrams per kilogram 12 hourly. Or you can give pregabalin oral in adults, 75 milligrams 12 hourly to resolution. Insurance are recommended. Referral criteria: refer complicated cases to a specialist.